One night I was getting my stepdaughter ready for bed and the dogs had jumped on me and I had dog hair and I just happened to look down and I went to go brush it off and I felt something and I was just like, okay, well that's not usually there. I just kept feeling and I was just like, okay, well that's a little odd. So I ran into the bedroom to where Tommy was.
She said, I need you to feel something. I don't want to feel like I'm going crazy. So I felt it and I said, that's a pretty size good knot right there. So she went to the hospital, told them what was going on, and they felt it and said, you just now noticing this?
I had never been there before. It's a new facility. They got us in really quick. I told the doctor and the nurse what was going on, and I was like, I know I sound crazy. I just need some kind of relief and I need someone to tell me like what's going on. And I didn't really think anything about cancer. I have PCOS, so I thought maybe it was a cyst. The cancer thought was like 2 seconds in my mind and then it went away because I have no history of family breast cancer or anything like that I know of.
She came in and she had found a lump in her breast and she and her husband were just talking and we kind of became friends instantly. She's not much older than me, so, just talking, it kind of felt like I was talking to a girlfriend. So I'm the one who did her mammogram, I did her ultrasound.
She held my hand during the entire process.
Just because if that was me, I would want the same thing too,
When they were done and I got dressed, they told me that Dr. Hunter wanted to see me.
And so when I saw her, she'd already had some imaging and that demonstrated an irregular mass in her breast.
Got into Dr. Hunter's office. Dr. Hunter comes in with this look on her face. And she said, Ashley, I'm so sorry, but it's breast cancer. Stage 2 invasive mammary carcinoma. I'm 31 years old and I have stage 2 breast cancer. Like, where does that even come from? I have no medical history of it. No family history that I know of.
I'd say it was life-threatening, absolutely. And she had a very aggressive cancer type.
My mom just instantly gasped and started crying. And all I could do was look at my husband.
Knowing my wife has got cancer, and it was rough.
I was at work at my office in Parker, Colorado when she called me. I internally wanted to cry. I was devastated because she is like my sister and I could hear so much going on in the background and she was so upset and it was just this, okay, I can't break down because she needs calm.
Dr. Hunter wanted me to get in to see Dr. Pro.
She's very, very young, and it's hard to see such young patients or young women going to diagnosis and provide, really emotional support that I am here throughout the journey, and then that we have excellent treatments and we're looking into curing your cancer. There are 4 stages in the breast cancer, and your stage is actually stage 2, which can be completely cured. I explained her that she has triple negative breast cancer, which is aggressive than most other types of the breast cancers. So I think once I talked to and I gave her the overview of what the treatments are, in what period of time that she'll be cured completely in 1 year, I think she was significantly relieved with that in a detailed explanation.
And that's when she told me the plan for what I was going to do. I was going to do 12 weekly IV chemo treatments every day, 5 days a week for 12 weeks.
During the first 3 months, Ashley comes in weekly for the treatment.
I had amazing support though. My mom, my husband, both came with me to some of my treatments. A lot of the times I just slept. Thank goodness for the Benadryl that they give you through your IV. I thankfully didn't get sick very often, but I stayed nauseous 24/7. Made it difficult to eat or want to eat or have strength to do anything. I was probably bedridden for a good 7 months. It was scary. It was scary, especially after I lost my hair. I think I started losing it within the first or second week of going through the weekly treatments. I did not realize how much I missed my hair until I lost it. while everybody was asleep, it was really hard for me to sleep. So in the middle of the night, I just stayed up and I made TikTok videos about like how depressed I was, how sad I was, like how much I missed my hair, how lonely I felt. Even though I had an amazing support system, I never felt so alone in my entire life.
It was rough. She kept her spirits up, but it was rough on her.
There were times where it was just, I'm just gonna give up because I can't do this anymore. I can't do the exhaustion, the throwing up, all of those side effects that come with it. And she kept going in spite of all of it. And she was so strong and brave and just pushed through.
It is a bit tough regimen. You go through significant nausea, a lot of the fatigue, and a little bit of anxiety. And then after that, we did a breast ultrasound to see how she's responding to the treatment. So in 12 weeks, when, she could no longer feel that mass, she knew even before I did the breast ultrasound that the treatment is working. After 12 weeks, we did the breast ultrasound, and there was a significant shrinkage in her breast mass.
After she completed her chemotherapy, we kind of re-imaged her, and she did demonstrate what we call a good clinical response. That means that the tumor shrunk down.
And then in January is when I had my lumpectomy.
So for her, it was important to keep her breast. She wanted to do what we call breast conservation. And after she shrunk the cancer down with the chemo, we were able to offer that to her. And so that's called a partial mastectomy or a lumpectomy. She had initially a palpable mass, but once she had chemo, it shrunk that tumor down and we couldn't feel it anymore. So we have to have some way to find that cancer in surgery, whether that be using a wire that gets placed preoperatively into the site of the tumor. I personally use what we call a localizer device. So it's a teeny tiny little clip, if you will, that gets placed in there. And I use a probe to help me find that area and excise it on the day of surgery. That specimen then gets put under an x-ray machine. We confirm that we retrieved the area of concern and kind of grossly analyzes the lymph nodes in patients like Ashley who had chemo up front, because if she had cancer in one, we would want to take more at the time of surgery just because it means those lymph nodes survived. So in her case, Ashley, we took out 3 and all of them were negative. All in all, she had a great outcome.
I remember coming out of surgery and just asking, did they get it all? Did they get it all? Did they get it all? And my husband was like, yeah, they got it all.
Typically after 2 to 3 weeks after the surgery, she comes back to see me.
Then in March, I started radiation.
At that time, she was recovering from her chemotherapy-related side effects. And in her case, the radiation therapy is used as an adjuvant therapy to help reduce the risk of the cancer coming back by killing any residual microscopic cells that may be left, which provides both a short and long-term disease control benefit.
I went every day for a month, the whole month of March. And they just take you into this room, lay you on a bed, and you just kind of go through like this, almost like you're going through like a CT scan.
She received 20 fractions of radiation. The initial treatment was to her entire breast over the course of 16 days, followed by 4 days where we focused the radiation on to the area where she originally had her cancer that was then previously removed. It
takes less than 15 minutes. I think the most waiting I did was just waiting to be called back. I don't think I've ever been so happy in my entire life. To hear that you're cancer-free and in remission is words that you don't think you'll ever hear. That was probably one of the best days of my entire life. Being married is pretty far up there, but don't tell my husband this, I might have to say that being cancer-free, saying I'm cancer-free might be just a little bit.
I was thrilled. I ran around and told everyone around me. I was like, she's in remission, she is cancer-free, as if she was my child who had survived the worst experience of her life. I was a proud mom.
To hear that she was in remission, she was excited, I was excited. Truly believe they saved my wife's life.
They definitely saved my life. I would not be standing here right now if I had not been referred to the Mitchell Center
All of the girls in our office, they were so happy for her too, being able to see these patients come back who they're going through all this treatment and everything, and then everything comes back and they're on the right path, everything looks good. There's girls that have come in who are in their mid-20s or late 20s, which I'm 27, so just seeing that, it hits close to home, you know.
It always feels better to treat the cancer, and it feels extra special or even better when I'm able to cure the patients. And Ashley is one of those fortunate patients who got completely cured. It's not that common to see in 20s or 30s. Typically, we see more breast cancer patients in 40s, 50s. We're still trying to figure it out why these young women are developing breast cancer at such an early age. The answer is still a puzzle. I think there's research going on. We're still trying to find out.
Advocate for yourself, ladies. Get your mammograms every year, and if something doesn't feel right, go see your doctor.
Most women don't realize, they feel like if they don't feel anything that everything's good, and the purpose of mammograms is to find something before you can feel it. We have patients who come and they miss 1 year and there's something there that possibly could have been found the year before. You know your breast the best, so if you feel something that doesn't feel right, then please come get it checked out. Just come in and get your mammograms, please.
They're amazing people. The staff there is so supportive. There's not a single person there that I ever felt they don't care about me.
From my point of view, they're the best people. I would go to them 100 times over for anything.
I commend them. They are a wonderful treatment center, and that's amazing that they have that there in Mobile.
We just want to help patients. We've got a wealth of academia that is associated with our institution, from clinical trials and research that may not be afforded elsewhere in the community.
We're fortunate at the Mitchell Cancer Institute to have an entire research wing associated with the Cancer Center, which helps provide a bench level or basic science level perspective, which then can translate into our clinic. So we're having researchers work essentially across the hall from us, developing new treatments that we can then employ and use in clinical trials for our patients who are currently under therapy with either radiation or chemotherapy.
We have the multidisciplinary approach at the Mitchell Cancer Institute, multiple scientists, the translational medicine people, constantly working on development of new drugs.
All those things combined were sometimes maybe overlooked. People in the community don't realize what we have to offer, but we offer a lot of the same things that you can get anywhere else at a bigger institution, but close to home.
They're not getting just the approach of one cancer doctor, which they're going to see at the other cancers. They're getting recommendations coming from 5 different medical oncologists. Today, Ashley is cancer-free, not just because of the provider that she's seeing me at the Mitchell Cancer. It's all the combined efforts. It's a team effort.
To feel the love and the friendship out of those teams is just amazing. I look forward to my visits. Even though some of them were scary, I looked forward to every visit. I knew that I would be heard. I knew that I would be listened to. I was okay coming forth and telling them that I didn't need to be scared because I knew they would take care of me.
The heroes are the doctors what take care of you. They're awesome.
Just thank you for saving my best friend's life. For Ashley, I know she's one person, and there are so many other patients that they even have now, but I'm just so grateful for the care they took with her.
Thank you. Thank you for saving my life. My gratitude is never going to be enough. And I just pray that they continue to do exactly what they're doing for everybody else that walks through their doors.